Good afternoon, everyone, and welcome. We are delighted to have you with us for today's session. My name is Sally Zweimuller, and I am a dissemination specialist with the Demographic and Health Surveys, or DHS Program. Today, I will be the host for today's virtual journalist webinar of the 2019 Ghana Malaria Indicator Survey, or GMIS. The agenda of our less than 2 hours together is shown on the screen. GSS will provide remarks and then present the key findings of the survey. Afterwards, we will host a Q&A discussion and we'll host a Q&A discussion followed by a demonstration of how to read GMIS tables and the DHS Program mobile app. If we could go back one slide, please. So that's kind of our agenda for the day so everyone can see. And I'd like to start with some expectation setting and a comment about our current situation. The COVID-19 pandemic has quickly changed our world. Our professional and personal lives have been greatly impacted. Amid the stress and uncertainty, we hope that you, your family, and colleagues are staying safe and healthy. The COVID-19 pandemic has required us to make some changes. Originally, we planned to have a series of dissemination workshops for the Ghana Malaria Indicator Survey at various events in Accra with the malaria community and the media. Today, we're joining from various locations in Ghana and around the world in front of our laptops or our mobile phones. We, the Ghana Statistical Service, the Ghana National Malaria Control Program, and the DHS Program want to show our appreciation to everyone joining us today. Thank you for your focus and commitment. We too have been working from home, so please have patience with any audio glitches. Throughout today's webinar, please mute your line and use the chat function to ask questions at any time throughout the webinar. There will be interactive activities as well, so we hope that you are participate and engage in those later in the webinar. The next slide. In today's GMIS journalist webinar, we will, these are our objectives. We will become familiar with the key findings from the 2019 Ghana Malaria Indicator Survey. We will participate in a Q&A discussion with GSS and NMCP, learn how to read and understand GMIS tables, and learn how to visualize GMIS data in a DHS Program mobile app. Next, I would like to introduce Dr. Nanayal Pepra from the National Malaria Control Program to provide some welcoming remarks. Over to you, Dr. Pepra.
Thank you very much, Sally. Thank you, everybody. Good afternoon to our Ghana colleagues, and good morning to our colleagues from who are joining from US. It's a great privilege to be part of this meeting and to represent National Malaria Control Program. The program manager would have loved to be in this meeting. Unfortunately, another equally important engagement had taken her attention, and so she's not able to be with us. But as we usually say, he's with us in spirit. And so hopefully we have a very successful meeting. We want to welcome you all to this meeting. And we also want to thank the government of Ghana and all our partners, USAID, PMI, Global Fund, WHO, for all their contributions towards the fight against malaria. We believe that hadn't been their contribution, we wouldn't have come this far. Unfortunately, malaria still remains a public health problem. It has health issues and economic issues to the country. And so the government of Ghana is committed to fighting malaria. We have put in strategies to ensure that malaria is prevented, and in the event that people have malaria, testing and treatment is adequately provided. As a program, some preventive interventions we have put in place includes the use of nets, intermittent preventive treatment for pregnant women, indoor residual spraying in some part of the country, etc. So we have a solid intervention. We also have a very strong research, surveillance, monitoring, and evaluation unit that works hard to ensure that we have good data to make very good decisions. And it is important that, because we are talking about data, it is important that we have surveys like MIS, and the findings of the MIS will help us as a program to make very good decisions. So the main objective of today's meeting, 2019 Ghana MIS, is to provide up-to-date estimates of malaria indicators in Ghana, including prevalence of anemia and malaria in children. In this survey, we collected information such as household characteristics, malaria prevention, knowledge, management of fever in children, and testing of children with respect to anemia and malaria as well. I wouldn't want to tell you what the presenters will be talking about today, but the great news we have for you is that the prevalence of malaria is going down, meaning that the interventions are working. And as journalists, we hope that we will continue telling people about the good news and tell them about the interventions we have in place as a country. I won't talk about the figures because the presenters will tell you about the figures. And we are hoping that when we are done with this meeting, it won't end here, but you will use your various platforms to disseminate the information, get to the people, let the people understand that the interventions available are very good and they have reduced the prevalence of malaria. And hopefully, as we all put our hands on deck, the vision of ending malaria will be achieved. So as we usually say, zero malaria starts with me. I believe that we all put our hands on deck and ensure that that is achieved. So once again, I want to take the opportunity to especially thank everybody, DHS, Ghana Statistical Service, and all our partners who have put together this program. I want to say God richly bless you all. Thank you very much. Sally, please take over.
Thank you, Dr. Pepra. Just so you know a little bit more about Dr. Pepra, he's an epidemiologist at the National Malaria Control Program and also a member of the Ghana College of Physicians and Surgeons. He also supports coordination activities for the Regional Malaria Monitoring and Evaluation Program held annually at the School of Public Health in Legon. So thank you, Dr. Pepra. And now we will move into our presentations today. We will have key findings presentation by 3 presenters. The first presentation will be made by Mr. Peter Pepra, Head Field Operations and Logistics Section of the Ghana Statistical Service and coordinator for this survey. The second presentation will be made by Dr. Samuel Opong of the National Malaria Control Program. Samuel Opong is a monitoring and evaluation specialist with the Ghana National Malaria Control Program. And the last presentation will be made by Mr. Wajib Mohammed, Head of Surveillance, Monitoring, and Evaluation at the National Malaria Control Program. I will welcome Dr. Peter Pepra to begin his presentation.
Thank you very much, Sally, and good afternoon, everyone. I think my presentation focuses on the survey methodology, which, first of all, before I tackle the methodology, let's make people aware that this survey was implemented by the Ghana Statistical Service in close collaboration with the National Malaria Control Program and the National Public Health Reference Lab, or the government Ghana Health Service. Financial support was provided by USAID, the Global Fund, and of course the government of Ghana. And technical assistance, so far as this project is concerned, was provided by ICF, that is based in the US, and usually handle or implement the DHS program, which is a USAID funded project offering support and technical assistance in the implementation of population and health surveys in countries worldwide. The project used the 2010 population and housing census frame for the design. But before that, let me say that this is the second in series so far as malaria indicator survey is concerned in Ghana. And it was designed at the time Ghana was having the 10 administrative regions, and therefore results are going to be presented at the regional level, focusing on the 10 regions. Of course, we have the national figures, and you can also see or get urban rural data so far as this report is concerned. But as I speak to you now, we are aware that we have 16 regions, of which the 6 additional regions were carved out of the old 10 regions. In that case, the northern region was further divided into 3, likewise the Brown Half region, and then the western region. So we have 2 in western region. We got 1 from western region, then 2 additional from BA, and then the rest also from the other areas. So in total we have 16. Next slide, please. Yeah, as I was saying, the sampling frame for this survey was that of the 2010 population and housing census. And we selected 200 enumeration areas. That's the first stage of selection. 200 enumeration areas, where we had 97 as urban enumeration areas and 103 rural enumeration areas, which we termed them as clusters. And out of this, in each cluster or enumeration area, we carried out listing exercise. The listing exercise is basically to capture information about all households living in these enumeration areas. And after gathering all the information from the households, which then became the frame, a sampling frame for the survey, 30 households were then selected from it for the second stage of the exercise. So in total, we had over 6,000 households. The 2 on it simply was derived from some dwelling units or living residential facilities that we targeted as having 1 household, but later through interrogation we realized 2 households were living in that unit of dwelling, and therefore together we had 6,002. However, we had 5,833 who responded and gave us completed questionnaire, let me put it that way. Out of this household, this number of households, we targeted women in the reproductive age bracket 15 to 49 who were selected for the survey. And then in these households that we have women 15 to 49, we also targeted children in the age bracket 6 months to 59 for the survey. As it was mentioned, the focus was on women and children under 5, so far as malaria is concerned, and anemia as well. Next slide, please. As I indicated, we had 6,002 households selected for the survey. And at the end of the day, we had a response rate of 99% at the household level. And women we found in these
Peter, I think we lost you. We're unable to hear you.
were filed and interviewed or participated in the state. Women responding to
Peter, I think we have not. Are you able to repeat, or shall we move?
Hello.
Oh, Peter, hello.
Yeah. Sorry.
There you are. We didn't hear this side very well. Yeah.
Oh, okay. I was saying that at the end of the day, we had 99% response rate at the household level, and likewise 99% response rate at the individual, that's women in the reproductive age bracket level. So my presentation ends here. Mr. Samuel Opon will take us through that of the malaria prevention. Thank you very much.
All right, thank you, Mr. Rupra, and good afternoon to all the journalists, and good morning to our colleagues also at ICF in US. So I would briefly take us through some results for malaria prevention indicators. Basically looking at insecticide-treated nets and intermittent preventive treatment for pregnant women, which we do across the country. Next slide. We'll start with indicators on insecticide-treated nets, which we call ITN. So generally in Ghana, we are seeing that ownership of ITNs, and I'll be saying ITNs, which supposes, which generally means insecticide-treated nets. So ITN ownership has increased over the years. Now as a country, we have 74% of households owning at least one ITN. Again, it's also reflected more in the rural-urban distribution, where we have more of the rural households having a higher proportion of, having a higher ownership of ITNs compared to the urban households. In terms of universal coverage or full household ITN coverage, where around the world, we are advocating for 2 persons within a household to have one ITN. We have a national average of 52% of households in Ghana having one ITN for every 2 persons that you meet in a household. Again, we have higher proportions in rural areas, or let me say rural households having higher ownership or full coverage of ITNs compared to urban households. So we have 60% of rural populations, or rural households having one ITN for every 2 persons, and then also 44% of urban households dwellings having one ITN for every 2 persons. And this disparity is just what we have been seeing in trends, because the net needs in urban areas are different from net needs in rural areas. Yes. Next. In terms of regional coverages, or how this is distributed across the length and breadth of the country, using the 10 regions which existed in 2019, we have the northern part of the country, specifically Upper East region, recording the highest ownership of nets in terms of household with at least one ITN. And then you have Greater Accra, which is more south, more urbanized, having a lower proportion of households owning at least one ITN. Greater Accra has 56%, whilst Upper East have 88%. But you take a region like Northern region also having quite high and Volta region, which has a high net use culture, also having higher figures than Greater Accra, which is very much urbanized. Again, next. In terms of trends of how we've come or how far we've come, we started this mass distribution vividly as a country. Mass distribution of net started from 2010 through 2012 and 2014 through 2016 and 2018. And so our baseline is 2008, just before we started the mass scale up of ITNs in the country. And in 2008, we had a coverage of 42% of household population having at least one ITN. This has increased to 74% in 2019, although there was a marginal increase between 2016 and 2019. Again, we realized that 2016 figures just came when we finished a mass campaign at the end of 2016. And 2019, there was no mass scale or mass distribution of net, so you just have a marginal increase. But in terms of full ownership of ITNs, household with at least one ITN for every 2 persons, we have a baseline of 17% in 2008, which has increased tremendously to 52% in 2019. Again, we didn't see any significant increase between 2016 and 2019. But then when we look at our baseline, then we've really improved, but then there is more room for improvement. Again, once we looked at ownership, we also now wanted to look at the use and the access. Next slide. Access is defined as if you take the number of nets in a particular household and you compare it to the number of people in the particular household, will people really get a net to sleep on if they want to? And so that's what we define by access. And we realized that in 2008, access to a net in a household was 30%. This has increased tremendously to 67% in 2019. Now, the more you push net into households, the more you have people having net, getting available nets to sleep under. But this is not the same thing as use. Whilst access is around 67%, we realize that people are not using the net as much as we expect them to use. So net use has increased from 21% in 2008 to 43% in 2019. And we think that we need to still improve upon our BCC or our behavioral change communication to really get people to really use the net that they have so that we can really close the gap between the access to net and the use of net at the population level. This net use was also investigated in children under 5 and pregnant women. And we realized that among children under 5 who slept under net the previous nights of the study, this has increased from 39% in 2008 to 54% in 2019. Again, a marginal increase between 2016 and 2019. But when it comes to use of net in pregnant women, we've also seen an increase from 27% in 2008 to 49% in 2019. And suffice to say that we had a slight dip between 2016 and 2019, which the program has taken steps to really improve upon net use among pregnant women through BCC and other interventions that we are trying to put in place. So that's for the net. Now, when we come to prevention within pregnant women, ITN is one of the components. Again, we also have an intervention we call intermittent preventive treatment, where women who visit antenatal facilities for antenatal services are given anti-malaria medicine, which we call sulfadoxine pyrimethamine, SP, and the women are supposed to take it till delivery, starting at 16 weeks of gestation of the pregnancy. And as a country, we've seen dramatic improvements since the country adopted the IPTP policy. We've seen IPTP 1, the first dose of IPTP, improving from 58% in 2008, to 91% in 2019. When it comes to the second dose, which used to be a recommended recommended threshold for the country, it's 46% in 2008 to an increase of 80%. So once you have 80% of your pregnant women taking SP, we think it's very good. But then WHO guided the country to realize that the more you take SP, the more the child is protected. And so in 2014, 2016, the country changed the policy that at least every pregnant man should take at least 3 doses of the SP. And from 2008, we've seen an increase from 28% in 2008 to 61% in 2019. And we think that with strong advocacy and also helping to put in logistics implementation challenges, we'll be able to get at least 80% of women in Ghana or pregnant women in Ghana taking at least 3 doses of SP during the period of pregnancy before they deliver. This is where my presentation, and I'll hand over to Mr. Wajibu Mohammed to continue the treatment and then the education bit. Thank you.
Thank you very much, Sami, for that presentation. So we've spoken about preventive. Now let's look at the management of fever, anemia, and malaria in children, as well as BCCA. So the treatment seeking. So let's look at the trend in malaria case management of fever and malaria in children. Treatment seeking declined from 77% to 69% from 2014 to 2019. Diagnostic testing also stagnated between the 30% between 2014 and 2019. What are the most common anti-malaria drugs that are used? Now, among the 30% of the fever, 2 weeks to the survey that were identified, 46% of them took an anti-malaria. This slide is showing us that among those who took the anti-malaria, 85% was ACTs. And artemisinin combination therapy is the recommended drug for treating malaria in children in Ghana, which is a good result that majority of them took the recommended drug. What about malaria prevalence? When we look at malaria prevalence by residents, what we can see is that we have a 14% malaria prevalence in 2019. And the prevalence is more than 3 times higher among rural children than urban children, with a 20% in rural and 6% among urban children. What are the regional variations in the prevalence of malaria in Ghana? We can see that Western region is highest with 27%, and Greater Accra with 2% as the lowest. This is the range. But we can also understand that from what we are seeing, we can notice that for all the regions, there was a reduction in malaria prevalence, with the exception of Western region that had a slight increase from 24% in 2016 to 27% in 2019. But there's a good news, and the great news is that malaria prevalence has reduced. Next slide. Malaria prevalence reduced from a 27% in 2014 to 14% in 2019. Now, What is the knowledge, malaria knowledge and communication? How is the knowledge among the population? Now, overall, 59% of women aged 15 to 49 have seen or heard a malaria message. Next slide. In the 6 months before the survey, the previous one. Urban women are more likely than rural women to have seen or heard a malaria message. So we can see that 65% in urban areas versus 52% in rural areas. What are the various sources of malaria messages? Among women who have seen or heard a malaria message in the 6 months before the survey, television was the most commonly cited source of information, with 77%. The other commonly cited sources of malaria messages include the radio, health worker, and word of mouth. So, with specific malaria messages, let's look at what messages the population heard a lot. So, among the women who have heard or seen a message about malaria, 93% have been exposed to at least one of the 7 specific messages about malaria. With sleeping under insecticide-treated nets being the highest, 72%, always test before treating malaria, 25%, and malaria kills, with 22%. These were the top 3 highest messages that were heard. Now, in May 2019, the Ministry of Health, Ghana Health Service, with support from WHO and PATH, introduced the RTSS malaria vaccine into the routine immunization schedule through the phase implementation program. The vaccine was introduced in Ghana in 3 regions: Brong-Ahafo, Central Region, and Volta Region. The survey took advantage to find out the knowledge about the malaria vaccine and people's attitude in terms of acceptance of the vaccine when it's going to be fully scaled up. Women were asked if they have heard about the malaria vaccine and if they would allow their child to be vaccinated. 1 in 3 women have heard about the malaria vaccine, and 9 in 10 women would allow their children to be vaccinated, as we can see. So 36% of them have heard about it, and then 90% of them would allow their child to be vaccinated. This is the end of the findings. Thank you for your kind attention.
Thank you for providing that presentation, summarizing the key findings from the 2019 Ghana Malaria Indicator Survey. At this point, I'd like to give you a little bit more information about our presenters today. I apologize for not following protocol in terms of introducing everyone. They will lead our Q&A discussion, so please type your questions in the chat box if you have questions, or we could, if you have a question, you could raise your hand as well. And while you are thinking of your questions, I will provide a little introduction to Dr. Pepra, who was our first presenter from GSS. He presented on the survey methodology. He is Assistant Chief Statistician and Director of Field Operations of the Ghana Statistical Service. And Mr. Pepra was the project coordinator for the survey. He's been involved in DHS, GMIS, and maternal health surveys implemented in Ghana as part of the DHS program since his involvement in the 2002 service provision assessment. And he's currently pursuing a PhD course in social studies at the University of Education, Winneba in Ghana. The second presentation was made by Samuel Pong of the National Malaria Control Program. He's a monitoring and evaluation specialist with the National Malaria Control Program. He's currently coordinating monitoring and evaluation activities and vector control interventions, routine data collection audits, and seasonal malaria chemoprevention. He is involved in capacity building of national, regional, and district health facility staff on capturing, reporting, and analyzing malaria-related data from routine health information systems, as well as other malaria data sources. And the last presentation that we just heard was by Mr. Wajid Mohammed, Head of Surveillance, Monitoring, and Evaluation at the Ghana National Malaria Control Program. He's been a member of the National Malaria Surveillance, Monitoring, and Evaluation Technical Working Group since 2012, and has been involved in the implementation of DHS, GMIS, and mixed surveys in Ghana since 2011. So this time I will hand over to Mr. Pepra of GSS to see if there are any questions you have. Please, you can raise your hand if you have a question, or you can let us know, type your questions in terms of the chat box. So Mr. Pepra, I hand it over to you.
All right, Sally, thank you very much. And colleagues, thank you for the presentation. I was part of it anyway. The first question is, despite gains made nationally, why is the Western region recording an increase in prevalence? This is from Joshua, Class FM. Wajib and Sami, could any of you pick it up, please?
Right. So that's a very good question and good observation. So the survey has actually given us what is happening. We're still looking into the reasons why the Western region would increase. Few things could actually, lead to this. There are some changes in the environment. For instance, we are looking into, has the increase in galamsey, for instance, had any impact on increase in the malaria prevalence in there? Because, you know, those activities also leave some maternity homes for the mosquitoes and among other factors. So we are looking into this. After finding out that this increases there, we're going to research into the whys, as we have just seen the what is actually happening. Thank you. Dr. Pepra could add some more.
All right. Dr. Pepra, the floor is yours.
I think that, Wajib, thank you very much. Exactly what Wajib said. Just also to say that we also realized something like that in the routine data and through stratification of our malaria data to the district level, which was done in 2019, we realized the need for us to even take IRS into that region. Because if you look at the data presented today, you realize that the northern region that used to have very high malaria prevalence had seen a decrease. And this could largely be attributed to the IRS, SMC, and of course, net distribution that's happening there. And so
Dr. Pepra.
Yes, please.
Sorry for the interjection. You are using some acronyms, IRS and others. Could you please use the full meaning?
Okay, that is fine. So IRS is indoor residual spraying in the northern part of Ghana. Most of you are aware that, for instance, in all districts in Upper West, we spray the interior environment, interior walls of the houses in Upper West region with chemicals, and when the mosquito rest on the walls, they imbibe the chemicals and they die. And this intervention is known to be very effective. So what the program did was, as we reviewed our data and as we prepared a new strategic plan for 2021 to 2025, this issue for Western region came up. And I'm just adding to the fact that it's a very important finding. We will continue to look at what is causing it, but we've seen it already, and we are trying to put in interventions like IRS, which has been very effective in the northern part of Ghana to help bring the prevalence down. So that's a very good observation, and we are working at it. Thank you.
Thank you very much. There is no other question in the chat room, but I'm giving our brothers and sisters from the media the opportunity to ask any other question if they have. You can raise your hand so that I identify you. Okay. Is it Joshua?
Yeah, Joshua is there.
Yeah, Joshua, could you please go ahead?
So, from the look of things, I just want to find out what's the projection. So, that's in the medium term. What's the projection for the prevalence of malaria in the country? And from looking at the data, are we on track to meet the projection? Thank you.
All right. Thank you very much, Joshua. Wajib?
Wajib, you are muted.
Sorry?
Wajib is muted.
Yeah,
Oh,
hello.
sorry.
Hello.
Yeah, Wajib, go ahead, please.
Okay, so we are looking at actually reducing the prevalence to the barest minimum. We are reducing up to about 10, and by 2025 we should get to about 7% prevalence in country. What are we doing? Almost all the interventions that we're doing are tailored towards ensuring this reduction. Dr. Pepra just mentioned that in 2019, what we did further to try and drive this agenda was to do a district level stratification. So normally you have the surveys that are regional level. And so even when we say Greater Accra is 2%, there may be some pockets of district in Greater Accra that are more than 2%. And so we try to do a district level disaggregation. And that is when we picked up the issues that Dr. Pepra mentioned about Western region having higher, is increasing in prevalence. So based on that stratification, a number of changes, or let me say a number of modifications have been done to the interventions. For instance, indoor residual spraying, which is the spraying of the sprayable walls, that is originally being done in the whole Upper West region and some districts in Upper East and Northern region. We are now adding Western region to indoor residual spraying. Seasonal malaria chemo prevention, which was originally in only the 3 northern regions, now OT region is also going to be added because it qualifies for that intervention. We're going to continue to strengthen our behavior change communication, as Sami said, to ensure that the ITNs, that's the use of in the insecticide-treated nets, use is actually improving. We're going to continue as much as we're going to continue to make sure people test before they treat. We're going to continue that the pregnant women get protection from the IPTP. So these are some of the things that we put in place to ensure that these things are good, alongside with monitoring the data and monitoring the implementation of these activities to ensure that we meet our desired outcome. This is what I have to say. Thank you.
Thank you very much. Joshua, do you still have other questions?
Yeah, so I have a follow-up question. So talking about the insecticide treated nets, there have been times that which we get to hear of, especially in the villages, that they use, instead of using them in their beds, they use them to fence sometimes their farms and those kind of things. So do we see such incidents happening more often, or there has been a reduction in regards to this incident? Thank you.
All right, thank you. Is this Sami, would you come in with the answer or a reaction to this question?
Yeah, so thank you very much. And that is a fair observation. I mean, not only fencing of the farms, we've also seen some. Now you realize that there are even tricycles around Accra which takes rubbish, and we find out that some of these nets are put on it. Basically, once you get the opportunity to interrogate somebody who has done that, the first response you get is that these are old nets. And so it has also become a concern for the country, and not only the country, for the malaria world in particular, to also now look at how to repurpose old net. Because for now, there is nothing like repurposing of net. And so households don't have really any guidelines as to how to treat old nets, which they don't need to use anymore. Of course, we have said that once a net has integrity, that means that there are no holes, it is still valid. You can still use it because it has that physical barrier against the human being and the mosquito. But then if what is lacking is that if the net is beyond the normal integrity level, where you have some large holes in, what should the household do? And so WHO is guiding the country to be able to come up with, what do you call it, guidelines to really repurpose old nets, so that we can really implement that and then be able to inform households as to, if your net gets beyond the level of use, these are the recommended actions you have to take. I don't know whether I've answered Joshua. Joshua, have I been able to answer your question?
Yeah, thank you very much.
Thank you.
Any other question, please?
Peter, there is a question in the chat.
Okay. There's Abba Asamoah. The question is a little observation. Apart from Greater Accra, all the other coastal regions recorded high prevalence. Could it be they use the ITNs for fishing instead of sleeping in them? Sami, I want you to pick it up, please.
All right, all right, Abba. I mean, for malaria prevalence, it's actually a multifaceted indicator, which means that you cannot attribute just one intervention to malaria prevalence, which you see. Because an example is that once you are adequately treating the people who are falling sick with effective anti-malaria, you are reducing the proportion of the parasites, or let me say the parasites within the population. So this is also another way of checking the prevalence level. Of course, the use of nets, of course, the use of IRS, but it's a good observation. But you see, in the net use, we didn't even do a geographical, but in the net ownership graph I showed, we also have a high proportion of net in a region like Volta region, which consistently and historically has been a region with a high net use culture. I don't know whether it is cultural or something, but then you find out that people in the Volta region and essentially more of the coastal areas really use the net. And suffice to say that you think they are pretty high, but compared to last year, where apart from Western region, Central region and Eastern region were the highest in malaria prevalence in the country. And this year we've seen them decreasing really well, especially in Central region, has really decreased tremendously from that. And so we can't associate just net use to prevalence. It's a mixture of all the other things. And this was the gap I was talking about. You realize that apart from Greater Accra, you have, which is the lowest, you have Volta region having like 85% of net ownership within the population, Western region 79%, and then Central. So when it comes to prevalence, it's a mixture of things. How people use, how people also take up the issue of, when I have malaria, what do I do? Because when you have the malaria and then you don't find effective treatment for it, they realize that the parasites don't also go and get transmitted to other persons, which eventually comes up into the prevalence data across the country. Thank you.
Thank you very much, Sami. It seems there is no other question and no hands raised. So I would like to hand it over to Sally. Sally, if you could pick it up and continue with, is it the stats compiler?
Okay, thank you for those questions. I encourage journalists, if you have any other questions, please feel free to ask those questions in the chat. I'm also going to share a link to the 2019 GMIS final report. That way you can look at this while we go through things, and maybe you may have some more questions. And in the chat box, if you see that link, this will send you to the full report of the Ghana 2019 Ghana MIS, so you can see if you have any questions related to that. And again, please feel free to ask any questions as we go through this. So I think what we're going to do next is my colleague, Annette McFarlane, will have a dissemination specialist with the Demographic and Health Survey Program, will now provide a demonstration on how to read and understand MIS tables. The tables are what are going to be in the final report link that I just shared with you. So Annette, I hand it over to you. Thank you.
Thank you, Sally. Now we're going to do an exercise on reading tables from the 2019 Ghana Malaria Indicator Survey. The final report and dissemination materials present some key findings in the text and using graphics, but not every finding is shown. It's important to be able to read the tables, which are at the end of each chapter in the final report, to find the specific data you need for your article or story, like malaria prevalence in Volta region, or the use of intermittent preventive treatment among pregnant women with no education. There are 4 main steps to reading and understanding tables that will help you find data to enhance your reporting. The first step is to read the title and subtitle of the table. They tell you the topic and the specific population group being described. The specific population group is the denominator or lower part of a fraction, and the indicator being counted is the numerator or upper part of the fraction. The title of this table is Table 4.6, Prevalence of Malaria in Children. The title provides a brief description of the table. Now I'm going to ask you a question about the subtitle of the table. And I'd like you to select the correct answer from the poll question. What is the denominator or specific population group being described in this table? If you're using a desktop or laptop computer, you can drag the poll question window to the left or right of the table, so that way you can see both the table and the poll question at the same time. On a mobile device, the poll questions will pop up in the Zoom mobile app. Click to select your response, or when you're in the poll question, you can swipe, click Skip Poll at the top left, or use your phone's back button to return to view the table on the shared screen. Once you have found the answer, click Return to Poll in green at the bottom right to return to the poll question and give your response. What is the denominator of this table? All right, I'm seeing some responses from participants. That's great. Yes, the subtitle tells us the denominator of the table, in this case, children aged 6 to 59 months. Great, thanks. The second step in reading a table is to scan the column headings. They describe how the information is categorized. Take a moment to read the column headings in this table as we pull up another poll question for you to answer. Remember, if you're on a desktop, you can drag the poll window to the left or right. If you're on a mobile device, you can toggle back and forth between the poll question and the table by using skip poll to view the table and return to poll to give your response to the poll question. Please select the correct answer to the question about the columns in this table. Which tests were conducted to determine if children had malaria? Which tests were conducted to determine if children had malaria? All right, I can see several responses from participants. That's great. So the 2019 Ghana MIS included rapid diagnostic testing, or RDT, which is shown in the two columns to the left. And the 2019 Ghana MIS also included microscopy to test children for malaria, which is shown in the two columns on the right. Now let's answer another poll question about the columns in this table. How many children aged 6 to 59 months were tested for malaria using microscopy? How many children aged 6 to 59 months were tested for malaria using microscopy? All right, I can see some good responses to the poll. 2,619 children aged 6 to 59 months were tested for malaria using microscopy during the 2019 Ghana MIS. If we look at the two columns on the right that refer to microscopy, we see the column farthest to the right is labeled number of children. This column shows us the number of children tested for malaria via microscopy in the 2019 Ghana MIS, and the last row gives us the total. The third step in reading and understanding tables in the 2019 Ghana MIS is to scan the row headings. These show the different ways the data are divided into categories based on population characteristics. Take a moment to read the row headings in this table as we pull up another poll question for you to answer. Please select the correct answer to the question about the rows in this table. How many background characteristics are there in this table? How many background characteristics are there in this table? All right, I can see several responses to the poll. This table has 7 main background characteristics. Prevalence of malaria in children is presented by age in months, sex, mother's interview status, residence, region, mother's education, and wealth quintile. The final step in reading and understanding tables is to find the overall percentages. In this table, the overall percentages or totals can be found in the bottom row. Let's answer a poll question about the totals in this table. What percentage of children aged 6 to 59 months tested positive for malaria by RDT? What percentage of children aged 6 to 59 months tested positive for malaria by RDT? I can see that most participants have responded to the poll. Yes, 23.0% of children aged 6 to 59 months tested positive for malaria by RDT. And most of you got that correct. So what about microscopy? What percentage of children aged 6 to 59 months tested positive for malaria by microscopy? What percentage of children aged 6 to 59 months tested positive for malaria by microscopy? Great, I can see that most participants have responded to the poll. Yes, 14.1% of children aged 6 to 59 months tested positive for malaria by microscopy. We got 100% correct answers there. Now let's do some practice questions. What percentage of male children aged 6 to 59 months tested positive for malaria by microscopy? What percentage of male children aged 6 to 59 months tested positive for malaria by microscopy? Great, I can see that most participants have responded to the poll. 13.9% of male children aged 6 to 59 months tested positive for malaria by microscopy. It's worth noting that there's nearly no difference in malaria prevalence between male and female children. All right, let's do another practice question. In what age group is malaria prevalence, according to microscopy, the highest? In what age group is malaria prevalence, according to microscopy, the highest? Great, I can see that most participants have responded to the poll. Malaria prevalence is highest among children aged 48 to 59 months. We can see that malaria prevalence generally increases as age increases. Ready for another practice question? Which region has the lowest malaria prevalence by microscopy? Which region has the lowest malaria prevalence by microscopy? Great. I can see that most participants have responded to the poll. Greater Accra region has the lowest malaria prevalence among children aged 6 to 59 months at 2.4%. In contrast, malaria prevalence among children in Western region was 27.0%, which is more than 10 times higher than in Greater Accra. Let's do one final question. Is there a clear pattern in malaria prevalence according to microscopy by wealth quintile? Is there a clear pattern in malaria prevalence according to microscopy by wealth quintile? All right, I see several responses to the poll question. This table 4.6 shows that malaria prevalence decreases as household wealth increases from 22.4% among children in the lowest wealth quintile to 2.1% among children in the highest wealth quintile. So now I'd like to take any questions if you want to type questions in the chat box. And I know that Wajib can also help explain about RDT and microscopy. So over to you, Wajib.
Or if there's anyone within NMCP or GSS that could speak on the two types of testing that we did for malaria, RDT versus microscopy. Thank you.
Right. So what we know is that in terms of a treatment of malaria, even if you've already been treated for an episode and you come within, let's say 28 days to a month, if you're tested with the test kits, you will still find it may pick a positive. The parasite may be dead, but antibodies are still in it, so the RDT will pick it up. So, but if you do a microscopy, that would clearly show you that the parasites are no longer effective. So sometimes this accounts for when you see RDT results being a bit higher than microscopy, because some of these interactions are still in there. Dr. Pepper can add, or Sami can add on to this. In fact, for this same reason, we don't even recommend RDT for review cases. For instance, you go for a facility, they test you, you're positive, they start treatment, you come for a review. We don't use RDTs for review. We use microscopy so we can see the clearance of the parasite as the medication is working. Yeah, Dr. Pepra and Sami, you can add on to that.
So, in addition, I want to say that because of the chances of having false positives based on the antigen antibody issue Wajib mentioned, the gold standard actually in Ghana is microscopy. We also know that RDTs will give us very quick results. And so we still give it to some facilities so that they will decrease the waiting time for our patients. If the prescriber still wants to test and be sure that it's malaria, the prescriber still has the liberty to do the microscopy. But it's largely for community interventions where microscopies are usually not present. So the RDTs are done, but in Ghana, the gold standard is microscopy. And largely because of the issues of false positive, you usually see RDT positivity rates higher than microscopy. Thank you.
Okay, if there aren't any other questions about how to read and understand MIS tables, again, we sent you the link to the final report so you can explore more of the data. Just to provide a little bit framework, what we've presented today is a small section of the what is available in the final report. We've given you just a snippet. There's so much more information and data available in the final report. So we do encourage you to explore that and read that as well. So next, if there aren't any questions, we will move into another demonstration on a great mobile app tool that we have. I did have one slide about this. Okay, great, there it is. So we do have the DHS Program mobile app. When you registered for this webinar, you were provided with a link to download the DHS Program mobile app. So in this session, we will learn how to access and download the DHS Program mobile app, how to select countries and indicators, and how to visualize the Ghana Malaria Indicator data, patterns, trends, and maps. And we'll also learn how to share this data with friends and colleagues. The next slide, the DHS Program mobile app includes 125 of the most popular indicators from over 250 surveys around in about 80 countries around the world. So the DHS Program mobile app is free to download. So it's available for in the Google Play Store or Apple App Store. So these are kind of the way you can find the mobile app. And I am going to share my screen. Or maybe we can click out of that so I can share my screen. Okay. Just one moment, sorry. Okay, great. So the DHS Program mobile app is available in your Play Store or App Store. So I'm going to demonstrate how you can find it in the Google Play Store, which is very similar to the other store. So when you go into your Play Store, you will search for, oh, sorry, not that one. DHS Program, and when you find, you'll see the DHS Program app, and it was created by ICF International. So when you click on that, you will be asked to install it. Depending upon your device and connectivity, the download speed of the app will vary. If possible, I recommend that you follow along and practice using the mobile app on a separate device. If you've already downloaded the mobile app, or if you're in the process of downloading it right now, please let me know by reacting with a green yes check mark. If you're unable to practice on another device, let me know with the reaction of a no red X. I see one check mark, so I hope you can follow along. You are encouraged to download and practice the mobile app at a later time. We've heard from journalists around the world that this is a great resource because it's DHS MIS data in your pocket on your mobile device, available at any time. Once you've downloaded the mobile app, you can click and open, and hopefully this will show you the mobile app. Okay. On the welcome screen of the DHS Program mobile app, you will see a hamburger stack menu at the very top left, which is about 3 bars, very common in other mobile apps. Here, if you click here, you can see the menu options that we have available in the mobile app. You can also, the settings I just want to highlight here momentarily is here's where you can change the language of the mobile app in French or English. We will keep it to English for this demonstration. At the home screen, you will notice that there are 4 buttons for easy access at the bottom of the screen. This includes quick stats, indicators, surveys, and maps. Today, I will demonstrate all 4 functions. First, we're going to explore quick stats to find the 2019 Ghana Malaria Indicator Survey data. So you will click quick stats. In quick stats view, you will see a list of countries that have implemented one or more of the following survey types: demographic and health surveys, malaria indicator surveys, and/or AIDS indicator surveys. If you scroll down until you see the country name of your choice, Ghana, and when you click on the country name, we will get to view the most recent data from Ghana. So let's click on that. Let's see if this works. Try again. Quick stats, Ghana. Okay. After selecting Ghana, you will be directed to a list of indicators. The indicators are generally ordered similarly to the order of tables in demographic and health survey final reports. On the upper right-hand side, we can see that the data displayed are from the 2014 Ghana DHS. You see up here at the right below the, underneath the Ghana flag, you see 2014 DHS. By clicking the forward and back buttons, I can look at trends between all the surveys conducted in Ghana. So I'm going to move forward until I reach the 2019 MIS data. I'm going to scroll down until I reach the malaria section, but want to highlight we have reproductive health, child nutrition, adult nutrition, and then malaria. Here you can see that we have some indicators here from the 2019 Ghana MIS. For this example, we will explore the indicator households with at least one insecticide treated net, or ITN. So I will click on the indicator name. After I've selected an indicator, the app first displays the historical trend for the country. In Ghana, the household ownership of at least one ITN has increased from 3.9% in 2003 to 73.7% in 2019. To explore indicators by background characteristics, select a characteristic below. So below the bar chart, you see residence, wealth quintile, and region. When I select residence, you can see that rural households, 84.5%, are more likely than urban households, 63.5% to own at least one ITN. You can also examine trends in residents by using this arrow up here to move back and forth so you can see how ITN ownership has changed by residents over time. You can also select wealth quintile and region, and I want to highlight the region, especially here is where you can find regional data for the Ghana MIS. So we were talking earlier about Greater Accra, Western, these areas of net use and ownership and malaria prevalence. So here we can see the regional breakdown of household ownership of at least one ITN. Next, I'm going to ask a poll question about wealth quintile. So I will click wealth quintile. I will read this poll question twice, very similarly to what we did earlier. The poll will pop up on your screen. If you have a computer, you can move the poll question around. On your mobile phone, you can minimize the poll and return to the question once you found the answer. So our first poll question is there a clear relationship in a clear pattern in household ownership of an ITN by wealth quintile? Do you see a pattern in household ownership of an ITN by wealth quintile? I encourage you to look at the visualization to see that the wealth quintile means that you'll see that 87% of the lowest quintile or the poorest households in Ghana own at least one ITN, and then you see that ITN ownership decreases to 60.1% among the highest quintile or wealthiest households. So I see that we have some response. Good. If we can end the poll and share that answer, you can see that yes, ITN ownership decreases with household wealth. Again, from 87% of the poorest households to 60% of the wealthiest households. Thank you. So I will move into the next activity. Oh, I wanted to, just in case you are interested, if you've made a great visualization and you want to share, you can do this in the mobile app. If you look in the very top right-hand corner below my clock, you'll see this box, a share icon that looks like a box with an arrow pointing outward. When I click on this share function, I can share this with my social media channels. I can text, I can email, and I can even WhatsApp. It's not doing that right now, but I'll try and demonstrate that in another screen. You can also take a screenshot of this and share it through your mobile app or other network. I'm going to return to the quick stats screen to show you one more thing about the Ghana data. The mobile app is made for offline use, but some visualizations and maps are only available online. If you know that you are going to be using the mobile app in the field or outside from data connection, it's a good idea to download the data before losing your connection. To download the data and use offline, find Ghana in your list and then press on the arrow beside the name of the country and select yes. So you'll see in this example, I have already downloaded Ghana data because I have a big X check mark here. It took about 11.72 MBs to download, but this means that I will always have the Ghana MIS data available. So for example, if I wanted to download the Gambia data set, a pop-up screen will show up saying the data are approximately 1.46 MBs. Do you want to download? And you confirm yes or no. Once you said yes, it will download. It'll take about a minute to download, and then an X will appear next to your data set because you have downloaded it. I'm going to return to the home screen by clicking on my hamburger stack so the menu shows up on the left-hand side. And now I want to explore indicators. To learn more about a specific indicator or compare indicators across countries, indicators shows me about 125 of our top indicators. When I scroll down to malaria again, you will see that we have these MIS indicators. When I click on a blue icon, the eye, next to any of these indicators, such as children under 5 who slept under an ITN, when I click that, a pop-up window will appear, providing me with the definition: percentage of children under age 5 who slept under an insecticide-treated net, or ITN, the night before the survey. I can click the X to minimize that indicator definition box. Now I'm going to click on this indicator, children under 5 who slept under an ITN, to explore more. The indicator section, so here you can see here is the list of countries that have this indicator. It allows you to sort the order of countries according to the results of your chosen indicator, or to separate them by region. So at the very top right, you'll see this sort with 2 arrows pointing up and down. When I click on sort, a pop-up with 6 options will appear. Now I have another poll question for everyone at this time. Which country in sub-Saharan Africa has the highest ITN use among children under 5? Again, which country in sub-Saharan Africa has the highest ITN use among children under 5? I encourage everyone to participate. Another very easy way to find this answer is if I sort by region and descending. I then get a list that shows me in sub-Saharan Africa what the ITN use among children under 5 is. It looks like we have a few people who have responded correctly, so we can end the poll there. You can see that Mali, yes, Mali has the highest ITN use among children under 5 at 79.1%. Well done. Thank you for that. Okay, so we will close this poll, and I'm going to return to the hamburger stack, the menu option, to look at another one of our functions in the mobile app, surveys. So if I click surveys, you'll see 3 options: all countries, recent, and ongoing. For this example, I'm going to explore recent because the 2019 Ghana MIS was just released yesterday. So when I click on recent, you'll see that there are several surveys that have been released recently, and I will click on the Ghana MIS. Here I get a screen with survey information. Who implemented the survey? The Ghana Statistical Service and the National Public Health and Reference Laboratory in Accra. What is the household sample size? You can see that there are 5,799 households were included in the sample, and that women aged 15 to 49 were included in the survey sample, and a total of 5,181 women were included. When was the survey conducted? Fieldwork was conducted for the survey from September 2019 to November 2019. You can find the answer to these types of questions in the survey section of the mobile app. So if you're wondering when the next survey will come out or when data will be available, the mobile app is a great tool to provide you with information about upcoming data from the DHS program. You can also see there are 3 tabs up top: information, publications, and quick stats. When I select publications, I can see the Ghana MIS final report is here. So when I click on that, a PDF will be downloaded to my phone, as well as a 2019 Ghana Malaria fact sheet. Journalists, I think you may want to look at this fact sheet. It's a quick summary of the key findings, many of which we have presented to you today, but also is a great resource as well for you to look and explore more about the Ghana 2019 MIS. You can also return to your quick stats. So you can see the quick stat Ghana data available on the mobile app. The last thing I want to show everyone is the maps. So when I click on the map function from my menu, I can now explore maps to geographically visualize data. You will choose an indicator from the very top. So right now you can see total fertility rate 15 to 49. But when I click on the drop down arrow, I get a list of several indicators. Again, it's about 125. I am going to scroll down here to see children under 5 who slept under an ITN, insecticide treated net. And when I click on that, you can see how the visualization changed, the map changed. Note at the very bottom of the screen, in the left-hand corner, you will see a legend at the bottom that provides values for the colors of the maps. Okay. So I can also, in this view, I'm going to zoom in to Ghana by using my fingers to move the app around so I can zoom in. And when I click on the shape of Ghana, I will get a pop-up screen that provides historical trends for the indicator. So here you can see that net use among children under 5 has increased over time from 3.9% in 2003 to 54.1% in 2019. I will X out of this by selecting closing it. And I can also switch to subnational data as well. So you see this button underneath the indicator name, it says subnational. So when I slide that over, I'm then provided with the subnational or regional data available for this particular indicator. I can also look at other malaria-related indicators. I can only look at one indicator at a time. So the next one I want to look at related to malaria is what we can do is children who took any ACT. I will switch it back to national, and here we can see in Ghana, it has increased from 58.8% in 2016 to 84.5% in 2019. Okay. So that is and again, let me see if I can try to do the share function. Yes, now you see when I click the top right button at the top that has the box with the arrow pointing out, now I can share this with my networks, WhatsApp, Gmail, and Twitter or Facebook, so that other people can see the visualization that I'm making. Again, if you create a screenshot as well, these are great tools that you could use to visualize in your reporting, whether it be on social media, online, or in print. You can use these data visualizations that you create here. Okay, so the mobile app, I've completed this demonstration. So let me stop sharing. Great, the mobile app demonstration is complete. So in summary, there will be a screen that shows what we've learned today. We've learned how to access and download the DHS Program mobile app. We've learned how to select countries and indicators, and we've learned how to visualize MIS data patterns and trends and maps. And we've also learned how to share this data with friends and colleagues. I'd like to know right now from everyone if you plan to use and learn how to use this mobile app to explore GIS data by reacting with applause or a yes check mark. So if you could please give me a check mark, that would be great to see if people think they will use the mobile app in your reporting. Okay, I see a few. That's encouraging to see. Great. I wanted to check back right now in the chat function to see if there are any questions. that have come up. Also, if you do have any other questions, please raise your hand at this moment. We want to give you the opportunity as journalists to ask any questions you have about the results and what they mean for Ghana. Any questions from our journalist? Okay, there's still time to ask some questions, so I'm going to hand this over to Annette to provide a little summary of what we've done here today.
Thanks, Sally. The 2019 Ghana MIS publications are now available online at dhsprogram.com. This includes the final report, the fact sheet, the data set, the wall chart, and infographic. Links to the publications and data sets will be shared if you provided your registration information. If you registered for today's event, we're going to send out an email with links. Print materials will be made available from Ghana Statistical Service at www.statsghana.gov.gh. And additionally, all of the Ghana MIS publications are available at dhsprogram.com. So you can also access statcompiler.com and, as Sally demonstrated, the DHS Program mobile app for more information on the indicators from the survey. We're open now for any questions that you have. Otherwise, thank you everyone for participating in today's 2019 Ghana Malaria Indicator Survey Journalist webinar. We will send a follow-up with the links to the various publications and tools that we discussed today. Additionally, we will ask that you fill out a survey to let us know what you thought of today's webinar. Great, I see a lot of green check marks. Yep, Sally?
Peter, I hand it over to you for some maybe closing remarks or other comments and thoughts.
Yeah, thank you very much, Sally and Annette, for the practical interpretation you've taken all of us through. I believe our brothers and sisters from the media would start exploring these links and these materials and possibly come out with articles or publications and ensure that the general public have access to the information. And I would like to also let you know that we are always available. If I say we are, I'm referring to the National Malaria Control Program and Ghana Statistical Service. If you want us to add any clarification to anything before you go out or before you publish, our doors are open. And let me use this opportunity to also express my appreciation on behalf of the government statistician and the management of Ghana Statistical Service. Unfortunately, the government statistician couldn't join us because today he is also doing a webinar dissemination on multidimensional poverty. So it's more like having a crash program. That's why he couldn't join us. So I would like to say thank you very much and God bless you. We have come to the end of the program.
Thank you, everyone. Have a good day.
Yeah, hello?
Wajid,
Yes. Okay, so
it has come to the end
yes,
successfully.
I just noticed, but if they are still on, just a few message that they should actually go out there and spread the message. We want the airwaves to know about what has just happened. We want the issue of malaria being on the agenda. We know COVID-19 is on, but the mosquitoes don't know quarantine. They don't know isolation. They are still causing a lot of damage. We've just noticed the impact of somewhat of COVID-19. People are not coming to the facilities and all that, but want them to know that malaria is still a challenge. Yes, let's talk about COVID-19, but let's also bring out the malaria issues up there so that we make sure that people don't die from malaria while they're trying to protect themselves from COVID-19. We are noticing slight decrease in the attendance of the health facilities because people are afraid to come. But when the people get sick and they find the symptoms, remember COVID and malaria have one symptom in common, which is fever. And so we'll need to make sure that we check and make sure that whether it's COVID or fever, you get the right treatment for it. We're noticing decrease in attendance, decrease in admissions, but we're noticing some relative case fatality looking a bit higher within this COVID section. So we want people to make sure when you feel sick, please go get the right medication. Follow all the protocols, but make sure you get treated. For journalists, you are the ones that are going to go out there. So make sure that we hear of you. We want to be hearing from tomorrow, the accurate data that you've been taught by Annette to interpret, but make sure that the message goes out there. The malaria is still here and the mosquitoes are not under quarantine, no isolation. So we follow the protocols, but protect ourselves from malaria. Thank you very much.
We do have a question if there are any resource people available for a media interview on TV.
Contact the National Malaria Control Program, and the program manager would actually, you find people to come and talk to you. We're ever ready. So just go through the channels. I think Dr. Pepper has given you links to contact Malaria Control, and you get someone to come and speak on your program.
All right, thank you very much, Wajib. And we nearly missed this last bit of your remarks. Thank you very much for bringing it out. So Sally, on this note, we bring the curtains down, but electronically we'll keep spreading the news. Thank you.
Wonderful to hear. Thank you, everyone. Please, we encourage everyone to use this data in your reporting. And as Wajib said, mosquitoes don't know quarantine or go into self-isolation. Thank you, everyone, and have a good day.
Thanks.